Monica, once you get the link, no, post it in the group.
Okay, ma'am.
Monica, once you get the link, no, post it in the group.
Okay, ma'am.
Good evening, everyone. I'm Dr. Bona Rawal, and on behalf of IIP Digital Media Team, I welcome you all to today's webinar, which is being organized by the IIP Women's Cell Andhra Pradesh State Team, celebrating the International Women's Day by organizing this webinar. The topic of the webinar is benefits of exercise and management of pain during pregnancy. And we have our speaker, Dr. Atisha CS, as a to share some of her valuable knowledge with us. And this webinar is also being live streamed on our official IAP YouTube channel, IAP India. Please like and subscribe us on all of our social media platforms to remain connected with the latest webinars. Now, without wasting much time, I would like to hand over the session to Dr. Monica.
Thank you, Rawal ma'am. Good evening, everyone. Myself, Dr. Monica Sunkara, State Sub-Coordinator of IIPWC APT. On behalf of IIPWC APT, a very warm welcome to you all. On the occasion of International Women's Day, we, the IIPWC APT, is conducting this webinar on the topic benefits of exercise and management of pain during pregnancy. I would like to thank Dr. Sanjeev Keja sir, the President of IIT, and Dr. Ruchi Vashman ma'am, the National Head of IIPWC, for giving us such a wonderful platform. My hearty thanks to Dr. Messi Jayapratha ma'am, the South Zonal Head of IIPWC, for supporting us. Now I'd like to introduce my state team. Firstly, our energetic state coordinator, Dr. Priyali Sarkar ma'am, who supports us a lot, and then our state joint coordinator, Dr. Firdaus ma'am, and state sub-coordinators, Dr. Shalini ma'am and Dr. Pallavi ma'am, who helped me a lot in conducting this webinar. I'm very happy to be the part of this team. Now I heartily welcome our AP State Coordinator, Dr. Priyali Sarkar ma'am, to share a few words and introduce our speaker. Over to you, ma'am.
Good evening, everyone. A very warm welcome to all of you. I'm Dr. Priyalini Sarkar, the State Coordinator of IAPWC Andhra Pradesh. It's been a while that we actually organized any webinars, and we take this opportunity of Women's Day as a wonderful opportunity to come back as a women's wing and do activities that are totally focused on women health, wellness, and mental wellness, also emotional well-being. And on this note, I would like to thank Dr. Ruchi ma'am and Dr. Sanjeev Jasar for this wonderful platform called IAPWC, which is the reason we all are able to connect to you, every one of you. I'm sorry, there's a little glitch here. Yeah, to connect every one of you on this platform, share our activities with you, and share a lot of views, take your feedbacks, and go forward with many better activities. On the Women's Day, I would like to welcome all women physios of Andhra Pradesh to come and join us in the IPWC AP state team also at district level, so that we can expand and work together for women physios and make a better society together. Thank you so much for each and everyone for joining us. And on this note, I would like to thank IAP Digital team a lot for collaborating such a wonderful webinar with us. And right now we have Dr. Bona Rawal ma'am with us. Thank you so much for taking your time out of the day and helping us here. Without much late, I would like to give the session to Dr. Atisha. Hearty welcome, Dr. Atisha, and we are looking forward to listen to all your views about this. And once your session is done, I'll come back again. It's all yours. Thank you so much.
Thank you for the great introduction, ma'am. And here I would thank President of IAP, Dr. Sanjeev sir, and the national head and the South zone head, and all the state coordinator and joint coordinator and state sub coordinator for giving me this opportunity. And without wasting the time, I would like to go into the session. And first, let me introduce myself. I'm Dr. Adisha, an women's health physiotherapist. And I'm an expert in antenatal and postnatal exercise and invasive pelvic floor rehabilitation practitioner. And I'm spreading awareness in breastfeeding and infant young child feeding educator also, and pursuing childbirth educator. So I would probably jump into the session. So today's my topic is benefits of exercise and management of pain during pregnancy. So as we know, during pregnancy we have so much of uh, pain we go through, and here we'll just see the start with the benefits of exercise, especially during the pregnancy. As we all know that exercise benefits a lot in our lifestyle, etc. But during pregnancy, it gives more importance to the pregnant woman. First of all, coming to the main point is maintenance and improvement of maternal fitness, which is very, very important during the pregnancy. And when we exercise, there is a best benefit of controlling of the weight gain, because during pregnancy more women are very inactive during their pregnancy period, and they doesn't do any physical activity. So what there is a chances of weight gain during the pregnancy period. So doing exercise will help them maintain their weight gain throughout their pregnancy. And improved posture and appearance also gives a benefit while you do exercise, and increased energy, and it also increases the sleep during the pregnancy, and self-esteem was also increased when you do exercise during the pregnancy. And the pregnancy main drawback is the back pain, which most of the women complain of the back pain. And for that, the main management is only the exercise. So exercise gives a drastic effect and benefit in reducing the lower back pain. And there will be increased incidence of varicose vein and water retention. Water retention is that edema which is very common during pregnancy, and one the lower limb is very much water retented during the pregnancy because of physical inactivity. And there is possible decrease in complication during labor. When the exercise is done throughout the pregnancy, there is decrease in the complication during the labor period. And there will be chances of shortened labor also. For example, if the labor is for going to like 14 hours or 12 to 14 hours, when we exercise throughout our pregnancy, the labor can be shortened, and it can benefit easily for the pregnant woman. And the more important benefit is that there will be more rapid postpartum recovery, as this is the main point we consider here. I would like to say more about this, because the postpartum recovery is plays a main role in a woman, as the woman is entering into the motherhood and she has to tackle so many things as a mother, as a new mom. She'll be facing so many issues after the delivery, like pain. If she has a C-section, she'll be having scar pain, C-section scar pain. And if she would have episiotomy pain, and she has to feed the baby sitting for a longer time, and managing her pain, etc. And the when the woman experiences and the pain, when the woman is doing exercise during her pregnancy time, then it is easy for the woman to recover faster in the postpartum period. So coming to the pregnancy related pain and discomfort, so there are lots of pain uh, faced by the pregnant woman, and it depends upon person to person. Okay, so coming to the first is very common is the backache and constipation, nausea and vomiting, heartburn, ankle edema, varicose vein, hemorrhoids, leg cramps, vaginal discharge, insomnia or sleeplessness, pain over round ligament, or we call it as pelvic girdle pain, and urinary frequency. These are the some pain which is faced by the pregnant woman. And coming to the discussion of nausea and vomiting, we'll be seeing about how to manage it. So usually nausea starts 4 to 16 weeks, and it is very common in the primary gravida mother, that is a first time pregnant woman, and it usually appears following first or second missed period, and it actually succeeds by the end of first trimester. For most commonly, it actually succeeds, but for some women, it actually prolongs during their pregnancy. So again, it depends from person to person. So how can we manage this nausea and vomiting throughout our pregnancy is having small frequent meals. So dividing the meals, 3 meals per day, dividing it into 6, we can manage nausea and vomiting, and avoiding spicy and greasy foods, and take lots of protein diet will help you. And anti-emesis are better to avoid it. Anti-emesis are the drugs which we give for the nausea and vomiting. So that should be better avoided. If it in case of severe nausea and vomiting, it can be taken under the prescription of the doctor. And avoiding slouching after meals plays a main role. So maintaining the posture is very important for the pregnant woman. So in the last, we'll be discussing about the ergonomics, what a pregnant woman can adopt. And drink plenty of fluids and eat fresh fruits and vegetables which are high in water content. That also helps in nausea and vomiting. And try to minimize stress in your everyday activities. So these are the management of nausea and vomiting. Coming to the constipation main role in pregnancy, and throughout the pregnancy, the woman feels discomfort because of this constipation, and this can last throughout the entire pregnancy. And again, it depends to person, and various factors contribute to constipation during pregnancy. We cannot suggest, or we cannot tell an exact cause of um, constipation in pregnancy. And how to manage the constipation is the first thing we have to maintain. The toileting position is very, very important. So I'll be talking this toileting position in the ergonomic under the ergonomic topic. And taking plenty of fruits, green leafy vegetables, and fiber-rich diet will help in constipation. And drinking plenty of water and regular exercise and even swimming can benefit for the constipation. So coming to the next is your backache, which is very, very common. Backache is common in pregnant women as she is progressing with her trimester. What happens is when the baby is growing inside the uterus, the weight is compensated by the woman, and what she does is she adopt a improper or incorrect posture during her pregnancy to compensate her backache. So that actually should be reduced and should be taught to the pregnant woman how to maintain her posture to reduce her backache. So the backache usually lasts from 20 weeks to the full term. So how can we manage the back pain is maintenance of correct posture and keep the weight gain under control. Because when we do exercise, we can maintain the weight gain throughout our pregnancy and avoid lifting heavy weights. And there are ergonomic which we have to adopt in while lifting the heavy weight objects, and we have to avoid high heels, and regular exercise is very beneficial for the to manage the back pain. And firm mattresses to sleep and enough rest, particularly in the later pregnancy, helps a lot. And avoid standing for long hours of time. And sleeping posture also plays a very good role in the backache. And keeping a pillow in between the knees while sleeping on the side will help you relieve in backache. Coming to the heartburn, which is very common in pregnancy. This is the common complaint the patient the woman gives when she is nearing to the labor. So this complaint is the result of reflex of acid contents of the stomach. So how can we manage this heartburn is by the propped up position after every meal. So this position helps in full term. So many of the women faces heartburn during the end of the trimester, where they cannot even rest for a long time, or they cannot even lie down flat. So what is the management is we can keep a propped up pillows, and she can rest on the pillows so that she is propped up in position, and that can manage her heartburn. And smaller meals more often will help it, and antacid will help in heartburns, and avoiding aggravating factors such as oily food, greasy foods, etc., or finding out which is not suited for the person can be avoided to reduce the heartburns. And coming to the ankle edema, which we can see usually after 28 weeks of pregnancy, this usually noticed in the ankles and the feet, and sometimes in the hands also. So how can we manage this ankle edema or the edema as frequent period of rest with limb elevation for at least 15 minutes each time will help you in managing the edema, and avoid long periods of standing or sitting will definitely help, and monitor your weight gain throughout your pregnancy, and exercise plays a main role when uh, while adopting walking, even that helps you in reduction in ankle edemas. Coming to the varicose vein, this is less common, which happens in 16 weeks till the term. It can happen at any time. And varicose vein in the legs and vulva may appear for the first time or aggravate during the pregnancy. So it should be checked. Varicose vein doesn't come in the legs alone, but for some women, it appears in the vulva also, which will be quite painful. And management includes applying elastic stockings or thread bandage for the leg varicosites, and exercising regularly will help them. And elevation of limb during rest will definitely help the varicose vein, and usually disappears after delivery. And even for the vulva, giving support to the vulva will reduce the pain and discomfort in the vulva varicose veins. So coming to the hemorrhoids, hemorrhoids actually happens due to the constipation, where the woman is straining to go to the stool, and prolonged sitting and spicy food aggravates the hemorrhoids. And how can we manage this hemorrhoids is taking high fiber diets to keep the stools soft, and drinking lots of water, and do not strain during bowel movement. And proper position while pooping is very much important. And to relieve the itching or the pain, the woman should try a warm sitz bath. So that is a pain remedy method, pain management, and use of laxatives to keep the bowels soft. Soft is also recommended. Coming to the leg cramps, which is very common during the last trimester, and this is due to the deficiency of diffusible serum calcium or elevation of serum phosphorus, which is responsible for this leg cramps. And the management includes supplementary calcium therapy and vitamins, which is being prescribed by the doctor, and application of local heat and massage helps the most in leg cramps. And walking and frequent ankle toe movements will help in reducing the leg cramps. Coming to the vaginal discharge, which is very common, this is due to the increased transitation of fluids as a result of increased vascularity during the pregnancy. The discharge is clear and not and white, and do not have unpleasant smell. So vaginal discharge, when we notice, it should be noticed in a proper way, and during the during the woman is nearing to the labor, she has to look for the vaginal discharge, where it can be a sign of labor also. So it should be analyzed by the woman, and she should have the knowledge whether the vaginal discharge is uh, having an unpleasant smell, or the pungent smell, or there is a smell difference in the vaginal discharge. So it can be taught to the pregnant woman to identify. And the management includes wear underpants with breathable cotton liners, and keeping the area clean, dry down there helps keeps bacteria in balance to prevent vaginal infection. As vaginal infection is very common during pregnancy, so it should be, the vaginal area should be maintained properly. And during the labor, what happens is there will be plug discharge when the woman is nearing to the labor. So after the mucus plug is the one which prevents vaginal infection during the pregnancy and during the labor, or before the starting of the labor. This mucus plug discharge from the woman, and after that she is very prone to the vaginal infections. So to avoid those things, she should be very careful in maintaining the vaginal area. So local cleanliness is very important. So coming to the next is sleeplessness or insomnia, which is very, very common in pregnant women, as the woman experience after 28 weeks till the term, she'll be facing this sleeplessness, and it has been attributed to the hormonal change that occurs during pregnancy, and can be a major cause of anxiety in the pregnant woman also. So this plays a main role, and after when she is nearing to the third trimester, she will be very conscious about turning to the sides, so that disturbs her sleep, and frequent urination will be common in the pregnant woman. So whenever she wakes up, her sleep will be disturbed, and so the sleeplessness is very common. So coming to the how to manage sleeplessness is doing daily exercises will help them most to avoid sleeplessness, and plenty of fresh air and avoiding caffeine and taking a warm bath before bed will help the pregnant woman to get a better sleep. And coming to urinary frequency, which starts in the second trimester till the term, urinary frequency is because of the uh, fetus which is growing inside the womb, and it just compresses the urinary bladder, where the woman feels frequency of urine very soon. So, how to manage this urinary frequency is by teaching the woman about the Kegel exercise can help her to control the stress incontinence, and leaning forward while urinating helps the woman to empty the bladder completely, so that she'll be at least free for few hours. So during bedtime, she can reduce the water intake so that she can reduce the urinary frequency during the night time, so it does not affect the sleeplessness during the night. Coming to non-practicing exercise during pregnancy. So many women, or in India, there is a culture where the woman is not allowed to exercise during the pregnancy because of so many reasons by the family and by the elders. But what happens when the woman is not practicing any kind of exercise, or if she is inactive, there are following conditions or discomfort she'll be facing. So the first is loss of muscular and cardiovascular fitness she'll be facing if she doesn't exercise during the pregnancy. So excessive maternal weight gain, when she is keeping on sitting without any physical activity, obviously the weight gain will be more, because she'll be intaking so much of food. She'll be having so much of food during her pregnancy, as she'll be having the cravings for food. She used to intake so much of food, and it results in weight gain. So overweight also it can result in. So excessive maternal weight gain, it can be lead to gestational diabetes and pregnancy induced hypertension also. And development of varicose vein is very common when the woman is inactive during the pregnancy. And deep vein thrombosis and higher incidence of physical complaints will be breathlessness. When suddenly she walks for a few steps or climb a stairs, she will feel breathlessness very easily if she is not exercising. And low back pain is very common. And poor psychological adjustment to the physical changes of pregnancy will be there if she is not exercising, and there will be slow postpartum recovery. So when a person is exercising through her pregnancy, her postpartum recovery will be a short span, that is within 4 to 6 weeks. She will be fully recovered from the pregnancy, and she will be able to continue her activities normally.
Dr. Atisha, I guess there is a little glitch of audio from your end. Sorry about the technical issue, guys. She will be ready in a while. In the meantime, I would like to ask everyone, if you have any questions pertaining to this topic, please do feel free to post them in this chat box. We will get them answered. And Meenakshi ma'am, is the Kegel's exercise answered in this session, or you want a detailed explanation? Yes, ma'am, we'll get that answered once we are able to connect to her audio also. I guess there's a technical issue. We are sorry about this. And anybody who want to just talk about this pregnancy topic, you can raise your hands. I guess Dr. Atisha is back again. Dr. Monica, can you call her? How to get rid of those varicose veins after pregnancy? I will let the speaker complete her speech, so that in that, if the questions are being answered, it's really good. If not, we'll carry on the questions in the session itself. We are really sorry about this glitch, guys. So in the meantime, let's go ahead and talk about the pregnancy. So as soon as a woman is married, the very first question that we get is, when will you give a child? So how many of you have faced this? Maybe many, and
Yeah.
I guess Dr. Atisha is back. So let
Yes,
her
ma'am.
talk.
Sorry for the
Yes,
inconvenience.
no, that's okay,
Yeah.
that's okay, that's okay. Please go ahead.
So, am I audible now, ma'am?
Yes, ma'am.
Yes, thank you for the
Yes, ma'am.
information. Yeah. So, every woman have a doubt. So, how much does a pregnant woman have to exercise? So exercise should start after consulting with the obstetric and gynecology doctor whom the pregnant woman is looking for, and after the confirmation given by the doctor, she can start exercising, and the doctor has to recommend or prescribe or direct the pregnant woman to a physical therapist, where the physiotherapist can recommend few exercises according to the discomfort or faced by the pregnant woman. So physiotherapist plays a main role in prescribing exercise for the pregnant woman, and the exercise should be according to the scanned reports which the woman shows to the physiotherapist and to the doctor. So at least by that, the physiotherapist plans a prescribed exercises which should be followed through the pregnancy. And the pregnancy exercise will be differing upon trimester wise. And the first trimester, the prescribed exercise will be low intensity aerobic exercises. And when she is continuing for longer period of time throughout her pregnancy, from when she is reaching her second pregnancy, second trimester, she can go with moderate intensity exercise, where the physiotherapist again suggests few exercise, add upon exercise, and the women should follow those exercise during her second trimester. And during the third trimester, again, the physiotherapist concentrate on labor pain management. What all the exercise can be is helpful for the pregnant woman for the labor. So the physiotherapist will teach the pregnant woman during her third trimester how to prepare herself for the laboring position and etc. And even after the postpartum period, the physiotherapist or the right person who can prescribe her with exercise to reduce her to check her diastasis recti and work on the diastasis recti and for the pain management also. So physiotherapists play a main role in prescribing exercise for the pregnant woman through her pregnancy journey and even at her postpartum period. So an aerobic activity is one in which the large muscles moves in the body in a rhythmic way, and moderate intensity means you are moving enough to raise your heart rate and start sweating. So, but you can still can talk normally, but you cannot sing. That is your moderate intensity that you can find it out very easily. So during exercise, the woman should not exhaust herself when she is doing exercise. And example of moderate intensity aerobic activity include brisk walking and general gardening and general housekeeping work she can do with. And uh, coming to the point where the pregnant woman does not find time to um work out or do exercise, the 150 minutes can be divided into 30 minutes workout on each 5 days. And even she can split it into 10 minutes of workout throughout each day. That is 10 minutes working out in the morning, 10 minutes in the afternoon, and 10 minutes in the evening. She can work out that way. And doctors also gives a benefit to the pregnant woman where she doesn't get enough time for to spend whole lot of 30 minutes for the workouts. So she can divide into 10 minutes each day. And if you're new to exercise, start out very slowly and gradual exercising should be there, and begin with as little as 5 minutes a day and add 5 minutes each day or week, and exercise throughout 30 minutes a day. And if you are very active during pregnancy, you can keep doing the same workouts throughout the pregnancy without any discomforts. Coming to the relaxation position, there are so many relaxation position which a pregnant woman can adopt. So I have a few videos which is attached to this topic, this relaxed position. So can anyone just confirm? Can you able to see my video?
Video is not playing still here.
On place now.
Is it visible, ma'am?
Yeah, it is now. It is.
Yes. So lying down comfortable, side lie on the left, and you can use a wedge-shaped pillow. You can use a wedge-shaped pillow to support your belly, and you can place a pillow in between the legs, which releases or relaxes your back when adopting this position while sleeping. So this is a very comfortable position throughout your pregnancy. You can adopt it. And the child pose, which is very comfortable and it can relax your back completely. So there is a picture attached to this, and forward leaning by with the help of the chair also relaxes your back. And these are the few relaxation position for the pregnant woman. So coming to the ergonomics. So when when we see a pregnant woman, we should not see the incorrect in her, but we have to know how to correct the posture of the pregnant woman, because posture plays a main role in all the things, including her digestion activities, including her back pain and leg pain, cramps. All the discomfort can be relieved by maintaining a proper posture. So I would like to share some points about how to maintain the proper posture when in standing. So the head of the pregnant woman should be lift through the crown of the head and keep the chin lifted, and ear should be in the line with the neck, as she is not tucking in the chin, or the head is protruding. It should be in the crown of the head and the chin should be lifted. And coming to the shoulders, many pregnant women adopt a slouch shoulders to compensate their weight of their bump, or to compensate their back pain. They adopt a posture of slouch shoulders. To avoid that, the shoulders and chest should be drawn back and down while the woman is standing in a proper posture. And coming to the abs and uterus, support contracting abdominal to support baby, and the gluteus should be under, and the tilting of the pubic bone slightly forward to center is a proper posture to adopt during the pregnancy. And coming to the feet, the woman should put equal pressure to both their feet, as she is not putting uh, pressure to one feet alone. That leads to uh, pain in her low back. So both the feet should be placed normally, and the weight distributed should be equal to both the feet. And coming to the next is the walking to maintain a correct posture. So I would like to show how the walking is adopted by a pregnant woman. Most commonly, this might be seen in many pregnant women. So here's the video. This is how a pregnant woman walks, with a wide base and increased curve and hands on her lower back. So this is the posture which is adopted by a pregnant woman. So that should not be done. Instead, she has to walk with straight back, and she has to walk normally with lower base of support. So this is the walking pattern she has to adopt. So I'm just playing it once again. So this is the posture which is adopted by the woman, because to compensate her uh, belly, she'll be adopting this posture, but we have to correct the posture to help her out. And coming to the uh, posture, side lying is recommended, but it is not very compulsory to lie down in the left side alone, but she can change the position by turning in the bed. So there is an video which has been attached to that. So turning in the bed should be slow and proper, where the woman can turn side to side during her sleep. So what happens is, when the woman is lying down in the left side, she can just lift up the hip and just turn, and again lifting up the back, she can turn to the sides, and she can keep an pillow in between the legs for the comfortable posture. So this is how a pregnant woman should turn. And coming to the getting up from the bed, the woman has to come to the edge of the cot, and she has to get up by putting both her legs down and pushing herself up from the bed. And uh, adopting this posture will help her not to strain her lower back so much. So this is the posture to adopt when getting out of the bed. So how to get up from bed during pregnancy is lift yourself up with the giving pressure to the elbows, and put both your legs down and lift yourself up by pushing with the hand. So this is the way to get up from the bed. And coming to picking object from the ground. usually picking object should be done only by squatting, because while picking up the object, when we are squatting, we are making the woman to do squats also without doing exercise. She can do this squats alone while picking up from the floor. Okay, how to lift object. This is the way we usually bend and take the object from the ground. So this should not be done. So instead, we would recommend them to squat properly and lift the object so she can maintain the squat and posture when she is lifting. And coming to sitting in chair, while sitting in chair, the woman should not sit slouched. She has to pull herself to end of the chair and she has to sit with support. Using the armrest chair is recommended during her pregnancy as she can rest comfortably. And if she is uncomfortable sitting in a hard surface, she can use a pillow under her gluteus, and she can use a pillow for the back support also. And while standing for a longer time, she can keep and rest the one leg on the stool so that she can do all the activities for a longer time. While she is cooking or she's cleaning the vessels, she can adopt a standing proper posture. And coming to the pooping with support, when we are pooping, this method is the very good and is the effective method for managing constipation and management of hemorrhoids and easy elimination. It is very, very good, which everybody should adopt in our day-to-day activities. So the main thing is, for the healthier way to sit in the toilet, we have to keep a stool that is footrest, where we keep the legs on the footrest and maintain a degree of 35 degree. Likewise, we are in the squatting position. So this actually helps in eliminating fully. That is, while squatting, puborectalis muscle, which is in the rectum, and that muscle gets relaxed and the rectum is straight. So the elimination of the bowel is fully happening. So this is a proper way of toileting position, which we can also take it in our day-to-day activities. And we can recommend the pregnant woman to adopt this posture where she would feel very comfortable during the pooping and toileting. So coming to the other managements, taking supplementary regularly is recommended for the pregnant woman, and keeping the woman hydrated during her pregnancy is very, very important, because keeping hydrated throughout the pregnancy will also plays a main role to prevent the stretch marks in the belly, and wherever she's putting on weight, there will be stretch marks which appears during her pregnancy. So keeping the woman, or recommending the woman to take lots of fluids and water will keep her skin moist, especially the belly and the lower limb, to prevent stretch marks. And adequate milk and milk products should be recommended, and the pregnant woman should take. And teaching the woman about the pelvic floor exercise is very, very recommended. That is your Kegels exercise, and exercise regularly for healthy weight gain. That is, during the 20 weeks, she can increase the weight, or weight gain should be 0 to 2 kgs she can increase, and 20 to 30 weeks, every week 1 kg should be increased, and 30 to 40 weeks 1 kg every fortnight should be increased. So this is the healthy weight gain pattern, and walking regularly should be adopted by a pregnant woman. Coming to the comfortable clothing. Comfortable clothing is also very important and plays a main role in pregnant women, because if she wears a tight cloth, it leads to breathlessness, and wearing comfortable clothing is recommended, and proper and fit brassiere is very much recommended, and maintaining of vaginal hygiene to avoid vaginal discharges and vaginal infection. Maintain vaginal hygiene is important, and sex is absolutely safe if the obstetric and gynecologist doctor gives a go for the sexual intercourse. So that is completely safe and absolutely safe during the pregnancy if the scans and the report shows normal. And coming to the don'ts, avoid being in the same position for longer time, this when the pregnant woman is sitting for a longer time or adopting a same position for a longer time, it results in swelling, and avoid stress during the pregnancy plays a main role, and taking tablets without doctor knowledge should be definitely avoided. And there is a concept in India that when we get pregnant, we should eat for the two, that is for the fetus to grow and for the body of the woman. So there is a concept of eating for two. That is not true, but 300 to 400 extra calories per day is more than enough. And do not wear tight clothes, and avoid wearing of heels, and avoid raw foods taking. That is also is not recommended during the pregnant times. And I'm open for questions. If there is any questions, you can just ask me.
Hi, Dr. Atisha. This is Dr. Priyalini Sarkar again. So I have few questions lined up here, few from the participants. And in the meanwhile, Dr. Monica, please check in YouTube if we have any questions posted there. And Dr. Adisha, I guess most of the questions are answered in your entire session itself, which is really wonderful. But still, there are few questions which need a detailed explanation. I hope this is okay. So the very first one is Kegel's exercise indicated in antenatal period?
Yes, it is indicated. Why? Because when we do Kegel's exercise is adopted in the antenatal period, it can even prevent the episiotomy, which is a procedure which is done during the labor. So that can be prevented when we do Kegel's exercise. And urinary frequency and incontinence is very rare, but few women faces incontinence during a pregnancy also, because the uterus is pressing against the urinary bladder because of the growing fetus. So the incontinence is common in pregnant women. So teaching Kegel's exercise will help them most, and even teaching of Kegel's exercise in antenatal period will help them to recover faster in the postnatal period also.
Thank you. And the second question is how to get rid of those varicose veins after pregnancy?
After pregnancy, it is varicose veins in the legs will be treated by the doctor, and we can also take steps like doing exercises. Knee to ankle to movements can be done while feeding. That can be adopted, and stockings can be adopted also, and that way we can reduce the varicose veins after
Thank
pregnancy.
you. Yeah. And most of the women, when we talk about pregnancy, pain comes as an added, bonus for that. So most of
Yes.
the women, as you mentioned it, most of the women don't even go to the doctor to get a prescription. They just they just send some of their family members to the medical shop to get the painkillers, which I have seen in many cases. So
Yes.
how much of painkillers can a pregnant woman take? Because when the painkillers are more, obviously the chemicals will be increasing in the body. Should there be a cap on how many painkillers can be taken?
Yes, as I mentioned, no medication should be taken without doctor prescription. So that is the
Hmm.
main thing. So no self-medication is allowed, as it can intervene their growth of the fetus also. So that is not even recommended. And here, as we are a physiotherapist, we are not uh, recommending any medications here. So
Exactly.
I'm sorry. Yes.
And the one thing that is, the walk during the pregnancy that you showed how you are supposed to walk. And that was
Yes.
an absolute amazing video because ergonomics plays a very major role in the normal delivery also. And the point you answered about the heels, don't wear heels. So when don't wear heels. But I have seen these are all the things that we see in our daily life when patients visit our clinics. Till 7th month also we see very well educated people also coming in heels. So can this result in the a painful delivery?
Yes, of course, because adopting a improper or incorrect posture, definitely they might be using the heels for the outside purpose. But when you ask personally, they would definitely have the lower back pain if they are using for a prolonged period of time. So that is very common. Without using the heels itself, the pregnant woman is very prone to low back pain because of their growing fetus and their improper adaptation of the posture. So that is contraindicated. The heels is contraindicated, but wearing it for some times can be accepted. But again, it will result in low back pain, and during the labor also, it is going to affect their posture and their well-being.
And I loved your, throwing the light on concept of eating for two. But
Yes.
usually, being in this Indian families, it's never about eating for two. It's always about eating for the baby.
Yes.
Whoever comes says, eat for the baby. This is good for baby. Saffron is good for baby. So, what kind of food that the actual pregnant lady should eat for herself? Because it's always about self-love. Everyone, once a woman is pregnant, everyone is more concerned about the baby than the woman.
Yes, exactly.
So can you just throw some light on how a woman should care about herself during this pregnancy?
Coming to the food intake, she can intake whatever food she likes because nausea and vomiting is more common in primigravida mothers. So we cannot compel a mother to eat this, that, etc. So that is the main thing coming to the pregnant women. And when we stress upon a woman to eat that and this, that doesn't go observe in her body because she doesn't like, she make faces, and that when she eats, it does not help her anymore. So whenever a pregnant woman eats, she should enjoy her food and eat.
Exactly.
That is the main thing. And avoiding of fruit juices should be avoided as it gives more of sugar content. So she has to take full fruit so that she can eat. And frequent meals she has to take. So not a single meal, that is breakfast, lunch, dinner should not be there. So in between, she has to break up and eat. Because of her growing belly and growing fetus, what happens is nausea and vomiting will be common and heartburns will be there. So she'll be suffering because of heartburns. And so dividing the meal like mid-morning, mid-afternoon, mid-evening, when she divides like that, it is definitely is going to help her to manage the heartburns and her food intake also. And there is no restrictions in taking any food. Other than the, if she is coming to gestational diabetes, there will be some restrictions. But other than that, she will be very well good in whatever food she can take. And especially raw food should be avoided.
Right.
So raw food should not be taken. That is raw meat, raw fish, raw chickens, or half-cooked chicken, half-cooked egg, half-cooked fish, chicken. Nothing should be there. So it should be when the cooking is there, it should be or full boiled, fully cooked vegetables and fully cooked meat. That's
So ladies, please do eat a lot, whatever you like, but in the infrequent intervals. And we have
yes.
a
And
question from the
regular
participant.
and to note that eating is good, but doing same amount of physical activity is very much during the pregnancy.
And we have a question. Can you please explain the PFM exercise in detail?
So that is very specific. That is Kegel's exercise, which we do. There are two types of Kegel's exercise, which is hold and relax, and the other one is squeeze and relax. And the first one is hold and relax, which is that we have to contract. That is, we have to squeeze in our vaginal muscles and hold it for 3 to 5 seconds, and we have to relax it after that. So there is a most common question for many women: how can I find out my vaginal muscles or pelvic floor muscles? Okay, so that is a quite common question, and they do incorrectly when they understand it incorrect way. So how to find out this pelvic floor muscles is the when we go for the pee to the toilet, and when we are peeing, and just suddenly when we hear a noise or something is happening in the outside, we just suddenly hold our urine, and after that stimulus or the sound goes, we just relax it. So this is most common. This action is done during the peeing in the restroom. So that is the main muscle we are working on, that is your pelvic floor muscle. So the other way to find out your pelvic floor muscle is by keeping a mirror in front of the lower area, and she can visualize from the mirror, and she can find out the vaginal area, vaginal muscles, and the surrounding pelvic floor muscles. So one is the hold and relax, where she can squeeze, hold it for 3 to 5 seconds, and she can relax it, and she can gradually increase the seconds hold. First, she can start with the 3 seconds hold, and gradually after she adopts to the 3 seconds, she can increase the holding time, that is 3 seconds to 4 seconds and 5 seconds, and she can improve like that. And the second method is squeeze and relax, which the fast which muscle fibers work, that is just squeezing and relaxing, just squeeze and relax. This is a fast twitch muscle fibers is getting activated during squeeze and relax. And Mostly these two exercises can be performed in any position, even sitting, lying down, and even watching TV, any position it can be adopted. And these are the commonly prescribed Kegels exercises.
That's very well explained. So I have one final question. Okay, right now being a woman physio, you are able to give this detailed explanation about pregnancy, its pain, and how to take care of it. Now, what is the role of women physios in this antenatal, postnatal physiotherapy that people are coming to us in spreading the awareness about how physiotherapy is important in coming to a normal delivery? Because
Okay.
as physios, we know, C-section can be avoided in a lot of cases.
Exactly.
So, what's the role of physios here?
Okay. So coming to physiotherapist role, we play a main role, but there is no awareness in our state and in our country because uh, doctor itself, that is even obstetric and gynecologist doctors itself, they just tell do exercise, that's it. They don't direct to the professions, that is I'm talking about few doctors. They don't direct to the physiotherapist, where the physiotherapist or the main person to prescribe exercise according to the body type of a pregnant woman. Yes, this is not a pregnant woman cannot do all the exercise which is there in the YouTube, or which a fitness trainer is recommending, or other articles are prescribing her. That is not the right way. But women usually they don't spend too much of time in going through the professions, but they use the YouTube and social medias to know what our exercise has to be done. But that is not recommended in our point of view, because that may end up in muscle spasm also. But when they are coming to a physiotherapist, physiotherapist can analyze her posture, how to we can guide the pregnant woman, how to maintain their posture, and what all difficulty she is facing, and we can recommend her that type of exercises, because each pregnant woman's body type is different. One may have hyperactivity of muscles or hyperactivity of muscles. One may have muscle soreness of the thighs, or one may have shoulder pain. So it is different. Body type is different. So they have to come to a right persons of physiotherapist, and they have to open up with what all difficulties they have, and we play a main role in the antenatal period. And coming to the physiotherapist, we have to recommend in the first trimester the set of exercises, and second trimester a set of exercises, and third trimester when the woman is nearing to the labor, we have to train the woman for to have a peaceful labor and the pain management, how she has to deal with the pain during her labor, and adopted position, which position will help her in the easy labor, and etc. The physiotherapist or the right person to analyze the pregnant woman and prescribe the exercises. And even during the labor, the physiotherapist can concentrate on the position of the birthing position. She can concentrate, the physiotherapist are the best to concentrate on the birthing position. And on the postpartum period, the physiotherapist shares so much of information regarding the ergonomics of breastfeeding, and how to maintain her posture after the breastfeeding. Even during the postpartum period, what happens is many women adopt an improper posture during the breastfeeding, which they end up with the shoulder pain, back pain. Even that is in the postpartum period. And what happens is that and all should be directed to the physiotherapist, where the physiotherapist will help again with their posture and their exercise also. Giving exercise for their fast recovery will be recommended, and that is also should be recommended by a physiotherapist. And diastasis recti, which is the main thing we have to look for in the postpartum period, and physiotherapist uses a technique to find the diastasis recti, and they prescribe you with the specific exercise for the postpartum women. And definitely many physiotherapists are showing a very good result in diastasis recti for the women when they are coming within the 12 months of period. So that is the role of physiotherapist. We have so much of role in antenatal and postnatal period, but it is not, there is no awareness around. So that's why we are getting lagged.
It's very powerfully explained, I should say, the role of physiotherapy and the role of physiotherapists in this pregnancy period. It's really powerfully explained. And we have two more questions. Please don't mind.
Sure.
And we have a question. Hi, suggestions for obese pregnant women who haven't healed their diastasis recti through previous pregnancy other than breathing exercises.
Okay, there are the main thing is the breathing exercise, the proper way of breathing. Okay, when we adopt a proper way of breathing and when we find out the abdominal muscles, when we are actively activating the abdominal muscles, that is the right way to reduce the diastasis recti during the pregnancy itself. We can reduce, we can work on it during the pregnancy itself. And once after the pregnancy, if we are diagnosed with diastasis recti, there are some exercises like pelvic bridging, single leg raise. What all exercise can be done? It can be done, but contracting or squeezing in the abdominal muscles or activating the abdominal muscles when we do the exercises, that results in closure of diastasis recti faster. So we have to incorporate abdominal muscle activation in all the activities, day-to-day activities, and the exercise also. So it is not alone just breathing. So it has to be incorporated in all the exercises and lifestyle modification also.
Okay. And how much perineal massage is needed from previous episiotomy?
Okay. Previous episiotomy, perineal massage is recommended. The perineal massage should be done by a physiotherapist. And even the physiotherapist can teach the woman how to do the perineal massage during her pregnancy, at the end of her pregnancy, where it plays a main role to reduce the episiotomy, chances of episiotomy. So that is the main role in perineal massage during the antenatal period. And after the episiotomy, that is postpartum period, the perineal massage should be taught to the woman so that she can palpate her scar and she can create sensation and pressure. Gradually, she has to increase the pressure. She has to find the episiotomy scar, and gradually increasing the pressure will definitely work, and massaging there will definitely increase the blood supply to the episiotomy, and the scar heals very faster. So that is
Thank
the
you.
main role.
And thank you. And we have one last question.
Sure.
Can you list down some trimester exercises?
Okay, so in the first trimester, when we physiotherapists assist, the scans should be very normal, and the woman should get a go signal from the gynecologist where she is allowed to exercises. So when she comes in the first trimester, low intensity exercise should be recommended if the woman is not physically active before. If she is not exercising previous and she is new to doing the workouts, she has to start gradually, and we have to recommend low intensity of exercises. And when when a woman comes with a previous workout sessions, or she is very physically active doing workouts every day, she can come into in during the first trimester itself, she can start with moderate intensity of exercises. So again, and in the second trimester, we'll be concentrating on exercise along with the breathing. So all the exercises will be done with the breathing. So we'll be encouraging her to maintain the posture, everything. And coming to the third trimester, we concentrate for the pelvic opening exercises. That is butterfly position. And there are so many exercises which we help the pregnant woman to help her open up her pelvic muscles and the pelvic girdle, so that she can deliver the baby easily without any interventions, if it is followed properly. So these are the sets of exercises which should be followed trimester-wise.
Thank you so much, Dr. Adisha. And it's a wonderful session, a powerful session, I should say. And it's a very blessing to be a woman, because we are the ones who carry the a baby into this world. So we are very powerful, and yes, pain comes naturally to us, and also we are so strong enough to take all the pain by ourselves. And the way you explained it today, for everyone, a pregnant woman is like piece of good news for everyone in a family. But what she goes through for the 9 months bearing the child, after the childbirth, a lot she goes through. But this detailed explanation of how physiotherapy can play a role in reducing the pain, how exercises play a role in reducing that pain for her, and the complete focus on women on this Women's Day. Thank you so much. We feel so honored and blessed to have you today. And everyone who is watching this session, she is Dr. Adisha from Coimbatore. She is a woman physiotherapist who is a guy who takes into gynecology, obstetrics, and she's the founder of Yuvati, right? Yuvati
Yes.
Women's Wellness Physio Care from Coimbatore, and invasive pelvic therapist. Whatnot, she's everything into women's physio. And also, I just came to know that you are the district coordinator of IAP in IAP district in Tamil Nadu.
Yes.
It's wonderful to work with you again, and all the questions are very well answered, and it shows it's not just the bookish knowledge, but how much we keep into practice and how much we give out that to people is what matters the most. And I think Dr. Monica did a wonderful job on bringing you onto board. Thank you so much for answering each and every question. And on this note, I would like to invite Dr. Monica to give the word of thanks. Thank you so much, Dr. Atisha. It's a pleasure having
Thank
you
you.
here.
Thank you so much.
Thank you so much, ma'am. That was a wonderful session by Dr. Atisha, ma'am. It was very informative, and it's for sure is the need of ours because pregnancy is defining moment in every woman's life, and being strong and healthy during this period is very much important. Once again, thank you, ma'am, for joining us in the webinar and also giving us such a wonderful and a valuable time, your valuable time and knowledge regarding women's health. It's our pleasure to have a wonderful person like you. My heartfelt thanks to each and every person over here, and I am very happy and honored to be the part of IAPWC APT. I would like to thank the President of IAP, Dr. Sanjeev Jha sir, the National Head, Dr. Ruchi Vashne ma'am, and our IAPWC South Zonal Head, Dr. MC Jayaprabha ma'am, our IAPWC AP State Coordinator, Dr. Priyalini Sarkar ma'am, AP State Joint Coordinator, Dr. Firdos ma'am, and AP State Sub-Coordinators, Dr. Shalini ma'am and Dr. Pallavi ma'am. My big cheers to my IPWC APT. And last but not least, my special thanks to Dr. Bona Rawal ma'am, our IAP technical team, who supported us all the time whenever we conducted the webinars. I would like to thank all the participants for attending the session and making the event successful. And don't forget to subscribe IAP India YouTube channel. Thank you.
And before leaving, I wish each and every woman out there a happy Women's Day. And for every woman physiotherapist out there, being a woman physiotherapist is our superpower. So please work on this sector more. Please help more women, to have a better living and be the rock star in your profession. And thank you so much, IAP Digital team, for giving us this much time. Though we ran out of time, but thank you so much for each and everyone for watching this. And a very happy Women's Day. See you all very soon. Thank you so much. All over to you, Raval ma'am.
Thank you, Dr. Priyalini ma'am. Thank you, Dr. Atisha, for this informative session, and everyone for being here as a part of this webinar. And please like and subscribe us on all our social media platforms to remain updated with the latest events. A very happy International Women's Day to everyone, and thank you. Have a great day.
Thank you.